I'll be starting this off today. So just to give you a little idea of who I am, I'm James, as it was brought up. I'm a Wellingtonian by birth. You can hold that against me if you want. I have experienced going through the mental health services. It worked really well for me, so lots of props here. I always like to start off with that because we get a lot of negative press in the space, and I like to remind people that there are some really good, really helpful things that happen in mental health. Some of my experience was I grew up with my mum who experienced bipolar disorder, and my granddad took his own life when I was a really young child. And I'm sure, as has been already brought up today, lots of you out there have your own experiences. And you'll probably find a lot of what I'm saying today, Dean already said a little bit earlier, which makes me feel sort of really smart, sort of really worried, because that means what I'm saying is sort of right, which is really good, or at least right to myself. But also, I don't know what I'm going to say if I'm just repeating everything, you know? So what I'm sort of going to talk about today is that I'm just representing sort of my experiences, and as a sector, we need to make sure that we keep remembering that and keep drawing on the ideas of young people. And as we've already heard, the inquiry, it noticed that there were some groups that it wasn't hearing from, and that we just need to keep on drawing from those and keep on finding those experts. So to talk a little bit about this is a quote from a young person that I heard. They were just sort of saying, I can't control the government, I can't control all of these services, I just have to sort of focus on what I can do myself. I have to always think, what is the thing that I can sort of go and do from now on? And I think that's been brought up a lot today, and I think that's really important. We don't have to sort of sit around and wait for the reply for the inquiry. We can go out and start doing everything we can. It's just getting all of those levers to try and sort of do that a lot better, I think. And just looking at some of them, I'm really going to focus on the people-centric part of the inquiry, which is why I think Dean has talked about a lot of what I'm going to say and had some really good thoughts around there. But this, I think, is going to be one of the greatest levers that we can use to sort of make sure everything is going the way that the people really want it to be going, you know? We're going to have reports back from these consumers by all of the DHBs, and I just want to make sure that that the levers are used in the right way. So my real questions about this are, who's going to be the people reporting back? How do we make sure that that's all working really well? And I think there's going to be a lot of really good leadership around there. But also I want to make sure that it goes out to the public. As I sort of started with, there's a lot of negative press that goes on for mental health, you know, and lots of the young people I talk to are like, I haven't heard of the mental health inquiry, what is that, how can I get involved? And I'm like, we're a little past at this point, but that doesn't mean you can't get involved. Here's all the things that you can do. Here's all the things that you can start in your community and sort of start pressing towards. So I just want to make sure one of the big things with this sort of reporting is making sure that we get our voices back out there. And it really covers one of the biggest barriers that every time I talk to people and I'm like, so why don't you have young people like in your services at a leadership level? They're like, we don't have any funding. And this is going to be one of those times that you can say, we need this, please give us funding, please let us have young people in our services. The next big one in Chapter 6, People Focused, is this, which is talking about the sort of resources that we should be trying to get to. And when I read this, even beforehand, there was a lot of thought of, okay, what sort of resources do we need? So I started looking back and thinking, what have I done? What has everyone else in the sector done? And there are some really great resources already out there. Like we looked at TAPO, there's the consumer competencies. So if you ever want to be like, all right, what do I need to look for in a young person? You can go look at them and it says, here are the key skills, here is how to promote those skills and make them be able to help your service more. There's a lot around cultural change. There's resources, again, from TAPO, there's Te Reo Hapai, and there's real language for real change, which is all about the words that we use in our services and making sure that they're actually using terms that are really helpful for young people. And these are just some of the quick, little, easy changes you can make. And then there's the things I was doing, going back to that starting quote. What am I trying to do now? What can I do before the inquiry, response to the inquiry comes out? So what we're doing is we're doing mentoring. We can go into any of your services. We can sort of support you there. You might be looking at this and being like, I've never had a young person in my service. I don't know how to start this. But we can help you out there. We have resources that say this is how you find people to recruit. These are the sort of people that you look for. Here's how you make a job ad for it. We're trying to make it as quick and easy as possible for all of you because I know it can be really terrifying. It's hard for me to go out and find young people when we're trying to do things. So I just want to make sure that's sort of as simple as possible back on your end. We've done things like made comics that sort of explain my job. It can be really hard when you go into a room and you're like, yes, I'm a youth consumer advisor, and people are like, I have no idea what that means. Please tell me a little bit more. So then you have to break it down, you have to explain lived experience, you have to talk about mental health, and there's always the fact that everyone's like, okay, yeah, I know what mental health is, I've sort of done that, can I sort of be involved in this? And then you're sort of like, yeah, get involved, stand up, get up there. So this is just sort of a tool that you can use to do it, and you can find all of this on our website. You can probably find copies of it floating around at Sector Day tomorrow. We'll do everything we can to make it as easy as possible for you. And just sort of thinking on to what we can sort of do, as I've talked about, getting some public reports in there I think is really important, making sure that young people especially, and as was talked about, all those missing groups, like homelessness is one of the big things that I focus on, and I try and be as involved in sort of homelessness collectives, getting out there, talking to people as possible. But we also want to make sure that the Māori voice is heard, Pacifica voice is heard, LGBT, representatives from all of those are really important, disabilities, addictions, making sure that they hear about this and that they know how to be involved. And the second point about quick wins is one that I think is really important and that I've heard a lot, is a lot of what people want is they don't want to have to tell their story repeatedly. They don't want to have to bounce around different services and have to say the same thing again and again, and they want to make sure that what their notes are having is accurate and that they sort of have control over it. So I think those are some of the really easiest things to do. And then in the long term, there's this idea that's sort of been floating around a bit of wellbeing navigators. So the idea of, we heard a story just before from the audience about how it's so hard to find out where services go. I've talked to people that have worked in health for years and years and years, and they're like, now I have a relative or I have myself and I need to find some assistance. I don't know where to go, and I've done this for years and years and years, so how can anyone else? So just that idea of every door's the right door, all these ideas that we've sort of been saying all along, Kappa sort of approaches, getting involved, making sure everyone just has a single path of entry, I think is really important. And this next bit is sort of the bit that I don't like to say around my boss because it sounds really bad. A youth consumer advisor is not enough. I really have to break it down and get into a long-winded talk about it to really talk about it. But the general idea is I'm not enough for any service to have all the youth participation, all that participation that I talked about earlier. I can't represent all of those different views. It's all about having a sort of culture that backs it up. So what I have to do is I have to continually go to all of these young people, talk to them, make sure that we're doing the right thing. And I also have to have my team around me supporting me. I don't know half the things about clinical things. Writing budgets scare me. It's all of these supports that I have around my team are really important, I became much better at my job simply by sitting in the middle of the office instead of hiding down in a little corner down the back, just so that everyone could sort of see me every day and be reminded, okay, we should get young people on board and make sure that it's sort of one of our primary focuses. And again, we are working actively to do this. So what our next big project is a bigger forum than we've ever had before for young people. We're going to have it in South Auckland in July, and we're just going to get as many young people together as we can and make sure that their voices are heard. I'm not sure how many of you people have seen this acronym before. Part of my job is to translate acronyms for people that may be older than 25. I myself am getting a little old, and soon I'm going to be youth adjacent, which not sure how I feel about that, but we'll see. So this means deep, meaningful conversation, and that's pretty much what we want to have. We've juggled around all of these terms. We've juggled around, do we have a hui, do we have a whānau, do we have a forum? Even Youth Consumer Advisor, we always get these questioning looks on, but until we come up with a better idea, that's sort of a working title. And that's just sort of what we do. We just keep on working, we keep on making sure that we're just trying the best that we can and keep pushing towards it. And that's sort of my systemic sort of look at everything. From there, I'd like to pass on to sort of the real expert sitting over in the chair, at least from his personal experience, and I'm just doing it from mine. Always important to remember.
Kau nui te maunga, whakatiwa te awa, takatimu te waka, nā te kahungunu te iwi, ko Brody Runga ahau. So that's just acknowledging my father's whakapapa. Also on my mother's side, there's Irish, English, Scottish, all sorts of other bits and pieces in there. So yeah, kia ora everyone. Here's me living a double life. So yeah, look, I'm just going to be talking about my experience of being involved in the sector through lived experience, but also this is the how I like to spend my time when I'm not doing this type of mahi. So I'm talking about placing people who access services at the centre of mental health and addiction system. I'm going to kind of talk about my experiences through my involvement with Counties Manukau Health, and then kind of look at some practical ways of kind of implementing consumer participation and consumer leadership. But before I do that, I want you to have a think about when was the last time you did something that you've never done before? Have a few kind of minute or so to think about that. I think you'll find that the older we get, the harder that actually gets to do new things. We're creatures of habit. And actually for myself, I know about change. I've had to make some pretty massive changes in my life, from polysubstance abuse disorder. Coming off clozapine was a massive change. So lived experience is very much where I've come from. I'm going to talk a little bit about, if I just going back to Counties Manukau, some of the things about Counties Manukau is, my first involvement with Counties Manukau mental health services was December 1998. Actually, I was in the inpatient unit, became my second home for about the next 4 years of my life. Then over the last 10 years, I've been involved in not just my recovery, but the recovery of my peers, and been kind of, when I first came into that world, who's seen this document before? Te Hananga, 2015. This document was pretty much, this was the shiz, we very much, we're looking at this document, some of my peers, that the peer leaders have got quotes in this document. We very much used this document to help support what we were doing in counties. One of the outcomes of that is the drive consumer direction, which I then went on to have the privilege of coordinating for about 4.5 years. At the time, it was the Alcohol and Other Drug Consumer Network. Then we went on to support a mental health consumer network. After a couple of years, we realised we're doing twice as much work as we needed to be doing, so we rebranded, restructured, and came up with Drive. It's an inclusive mental health and addiction consumer network. Drive is an acronym, stands for Development, Recovery, Information, Voice and Education. And really it's about building capacity. It's about building capacity for both the people coming through recovery, but also building capacity for the sector. And one of the things that made it really successful was strong partnership with the District Health Board funder and planner. There was also a strong partnership with NGO and providers, and that was really crucial. In Counties Manukau, we have between 60 and 65 full-time equivalent peer support roles across both DHB and NGO sector, and both mental health and addiction sector. Just quickly, I want to point out that the importance to differentiate between employing people with lived experience and employing people into dedicated lived experience roles, so dedicated peer roles. There's quite a difference there, so yeah, when you're considering doing that, be really clear about that. One of the recent outcomes from the Drive Consumer Space in partnership with AED Collaborative was the Recovery College project. That's really about developing some co-production ways of doing things and developing education through co-production with lived experience, service professionals and family whānau. So you know, the fundamental concept of Recovery College is that all three of those kind of worldviews need to be involved in what's being learned and taught within that space. It's a learning and teaching environment. So I'm also going to look at some co-production principles. It's an uneven playing field at the moment. So really that talks to the experience of someone coming into a service, and you know, it's not just about the compulsory treatment order, it's also about the kind of coercion that happens, the expectation that you're a passive recipient of service. And as a provider, there's this kind of passive-aggressive approach to providing that service. We need to change that, and I'd just like to tautoko Dean for what you were talking about earlier on today. Yeah, you pretty much said all the things I was hoping to get across this morning, so I'm just going to kind of now look at some practical ways of how we can achieve that. So firstly, we need to define people who use services as assets with skills. That lived experience and that includes the whānau as well. How do we know what's meaningful to people unless we're actually seeing them as assets and working with that? Need to build on existing capabilities. Part of that's providing training and development. Like Dean said, there needs to be succession planning for consumer leaders. We need to break down the barriers between service provider and service user and family whānau. It needs to be seen as this whole thing together. That goes without saying, but how do we do that? We do it by creating opportunities to actually get to know what's meaningful to people. So this speaks of actually creating outcomes measures that are meaningful to people. Hopefully that all goes without saying, but I've put this slide in here around the marama real-time feedback. I don't know whether you all utilise real-time feedback or not, or whether you use similar tools. I worked for an organisation for about 4 years where we managed to collect over 4,000 surveys through marama real-time feedback. That's fantastic. I think there's this huge wealth of consumer experience data within that. I think we need to be supporting organisations how to actually understand that data and make use of that data. Two of the key themes that I saw come through the data that we were collecting, people aren't necessarily feeling involved in decision making, family and whānau aren't feeling involved. And they were two really obvious themes that came through that data that we were collecting. Flexibility times diversity plus inclusion equals innovation and responsivity. With the current kind of funding models and how that looks, it's killing innovation, it kills responsivity, so I don't know how you're going to tackle that. It's one thing to have consumers, involved in everything we do, but if the funding models are going to dictate what we do, well then, I'm not sure. Needs to be a whole system approach. So just building on what James was saying, there needs to be a unified kind of way of doing this across all DHBs, and there needs to be accountability within that. to make sure that there's consumer participation and leadership, all the way from, I'm suggesting there needs to be consumer networks as well as consumer advisors. So otherwise, consumer advisors are speaking on their own lived experience. They have to be speaking on everybody's experience. Be really clear about the values. So these are from Tapo's peer competencies, and these values, if you're wondering, how are we doing this right, these values kind of help steer the way. Be really clear about those values. I just put this on there because, sure, glad the hole's in at our end. We're all in this together. And that just about wraps kind of some of the practical things I wanted to share this morning. But just to also, I just wanted to quickly share with you around my own personal, the things I gained from being involved in the sector the way I have been. Last year, both my mum and dad passed away. And the biggest thing that made that not so difficult. Trust me, it was fucking awful. But one of the things that made that bearable or helped me cope with that was the fact that I knew mum and dad were proud of me, and I knew mum and dad could trust that I was going to be okay. The biggest thing, I could also trust myself. Coming from someone who, over 20 years of my life, was a polysubstance user, over a decade of my life was treated for a psychotic disorder, over a decade of my life was using methamphetamine hazardously and intravenously, then being able to look back on that a decade later and see myself as a leader in this space, and knowing that my parents were also proud of me and could see me as a leader in this space, that's a huge benefit to myself and my family and whānau, and I want to see more of those opportunities for people like me. Kia ora.